physicians who care about universal health care. He is a true ally, spokesman, inside out, understands what's wrong, and has thoughts about how to fix it. So, hopefully you'll be spending a lot more time in DC in the years to come. Right? And then I can host stuff for you in a different setting.
Well, I appreciate it.
Thank you. Thank you for everything you're doing.
Thank you so much. Thank you. Round of applause for Joe. Amazing leader at PNHP and beyond. Just grateful for your leadership, and thank you. So grateful to all of y'all for being here today. Thank you. I know this is sort of like a dovetailing of PNHP and APHA. And I'm like, hey, wait a second, I'm a public health doctor who wrote a book on Medicare for All. This is great. So I really, really appreciate it because y'all are my people. And I'm honored to get the opportunity here. I just want to say a couple words about this moment right now. All of us here are involved in the work of healing, right? Some of us in the work of taking care of people after they've gotten sick. Some of us in the work of trying to create a world in which fewer people get sick in the first place. All of that is under threat. I don't have to tell you all of that. To me, I just want to give you a little sense of why this work is so critical to me and about where we go from here. So my parents are an Egyptian immigrant, and my stepmom, who raised me, is a daughter of the American Revolution. All right? So Muhammad and Jack. And you can imagine, right, my two grandmothers. One of them I would see on trips to Egypt in the summer where my folks would kick me out with whatever family was going, who was the smartest person I've ever met in my life but never got to go to school. She was the 9th of 14 in mid-century Egypt, in a time and a place where women couldn't get an education. She gave birth to 8 kids. 2 of them died before their first birthday. My other grandmother was born and raised in Ann Arbor, Michigan. She went to nursing school at Hurley Hospital in a time where women couldn't become physicians. And she gave birth and raised 3 kids. Her name was Judy, the other one was Suad. And in any given summer, I would traverse between the two. These 2 women could not imagine the lives that one another lead. And I remember having to explain one to the other. But here's the thing about it. When your grandmother gives you a kiss on the forehead, makes your favorite meal and tells you, I love you, it is the same language and it's the same love. And that's the thing I wanted them both to understand. And the thing that we all do every day is about protecting that. All of us are souls living in bodies, and when those bodies or their minds get sick, right, they deserve care. Whether you're talking about somebody in Egypt or you're talking about somebody in Michigan. And we find ourselves in this moment here and now in a time and a place where folks want to dial back so much of the critical work that's been done to address the ways that people suffer. So in those trips, I would travel 15 hours to Egypt, and I travel about 10 years difference in life expectancy. I didn't have to go 15 hours. I grew up just outside Detroit. I could go 15 minutes into the city and travel the same 10-year life expectancy gap. Now, 10 months ago, I was sitting in my office in Wayne County, leading health, human, and veteran services for the county, a team of about 550, a budget of about 172 million. In a role where, because of the American Rescue Plan Act, we could do some really big things. We found that our county ranked number 8 nationwide for medical debt, and that we could probably eliminate it for pennies on the dollar, so we did. We set aside $7 million to erase $700 million of medical debt for Wayne County. We put Narcan, life-saving anti-overdose medication, in vending machines in 100 locations across our county. We built a program to provide new small businesses guaranteed health coverage for 3 months to help them get off and start in the right ways. Protection against that risk that every new small business owner has to take around how they're going to be able to provide health care for themselves, their families, and their employees. And I was sitting in that role, and I get a notification that they've frozen federal funds. So I'm sitting here in my office looking at all of the line items that they've frozen. WIC, which by the way has run out of money. Food on the table for moms and babies, frozen. federally qualified health centers, the last line of health care for people who otherwise can't get it, frozen. Vaccines, frozen. And in that moment, I get a push notification to my phone that after his long and storied career, our current U.S. Senator, Gary Peters, is not seeking re-election, and there's an open U.S. Senate seat. And the funny thing is, the first text I got was from Rashida Tlaib. It was like, Habibi, this one looks like yours. And she said that because I'd run for governor back in 2018. Now, when I graduated college, I was the valedictorian in my class at Michigan, and I was selected to give the student commencement speech, which was a real honor. And the only reason anybody actually listened to what I had to say, including my own parents, is because of the main speaker that year, and that was Bill Clinton. So, Clinton, I give my speech, all right? And like, it's still the biggest speech I've ever given, 60,000 people. Clinton gives his speech, mentions me in his speech. My dad claps for me for the first time in my life. And after the speech, he comes up to me, son, why are you going to medical school? Which nobody asks a graduating senior going to medical school. And my first answer that came to my mind was like, look, I'm brown and Muslim, it's what we do. But also, I love people and I love science, and this is how I want to serve. And he's like, that's great, but you got a gift for communicating. Maybe you'll run for office. I looked at him for a minute, I was like, did you see my name? There are 11 letters in my name. It's got sounds that come out of parts of people's throats most people don't know they have. Like, people like me don't get to run for office. The next year, that was 2007, the next year I watched Barack Hussein Obama run for and win the presidency. All right? Now, 2018 rolls along, Donald Trump gets elected, and I'm like, oh, hell no, right? And so, on bad advice from a former president, I decided to run. And we ran a spirited campaign for governor. We got outspent 7-1, all right, but still took 30% in a three-way primary, finishing second. We were 2-1 more efficient than the person who ended up winning, who was Gretchen Whitmer, our current governor. And fast forward, I had said something at the time folks weren't quite ready to hear, which is this. Donald Trump himself is not the disease of our politics. Donald Trump is just the worst symptom of the disease of our politics. The disease is the system that allows corporations, billionaires, would-be oligarchs, to buy and sell politicians in ways that have them rigging the system against us. And nowhere do we see that more intensely than in our healthcare system. The number one biggest lobbyist by sector is pharma, $4.3 billion over the last 20 years. Number two, insurance, $2.4 billion over the past 2 decades. Number 8, hospitals, nursing homes, $1.7 billion. Just lobbying. That doesn't include electioneering. That doesn't include the super PAC money that they drive into people's minds to make them believe that the healthcare system could be no better than this. On this race, I get the opportunity to travel my state. I've been to 63 different cities. I've done 146 public events, but who's counting? I've been to places where literally, like, I've multiplied the Arab American community by 2. Right? And the thing about it is, people understand that the moment we're in right now requires us to think foundationally differently about the circumstances. Because if Donald Trump is the worst symptom, right, our democracy is on its deathbed, but it has been suffering a chronic disease for a very long time. And unless we're serious about taking on that disease, unless we're serious about articulating what we're for and not just what we're against, I worry about where this goes. So we're running on 3 simple things. Number 1, got to get money out of politics. Number 2, we got to put more money back in people's pockets. And number 3, in the richest, most powerful country in the world, medical debt shouldn't exist, and we've got to pass Medicare for all. And so in towns across the state, that message is resonating with people. Last week, I was in Houghton. Does anybody know where Houghton is?
Yes.
Michiganders know where Houghton is? So the Upper Peninsula has an Upper Peninsula in Michigan. All right? Houghton's in the Upper Peninsula's Upper Peninsula. In theory, nobody should show up to listen to my brown ass talk about healthcare. All right? But folks came. We filled the room. And they asked really good questions about where we go from here. People are hungry for this. So my ask of you today is let us give the people what they need and deserve. This campaign pulls 0 punches. This campaign is honest about the circumstances that we are facing right now. This campaign is honest about the fact that the only way we solve our unraveling healthcare crisis is to finally guarantee people healthcare from cradle to grave. This campaign is honest about the fact that there's no way to actually address our crumbling schools or infrastructure if we continue to send all of our money abroad to drop bombs on other people's children rather than to take care of our own children. This campaign is honest about the fact that if they're going to try and cut Medicaid to pass a tax cut for the richest people, maybe it is time for us to pass a centimillionaire and billionaire tax to pass Medicare for all for everybody. We can win on our morals. We've raised $4.1 million. We raised more in the last quarter than any of my opponents in individual contributions. We are polling tied for first statistically with a U.S. Congresswoman who is taking huge amounts of money from corporations in APAC. And we have all the momentum on the ground. But we cannot do it without support from folks all over the country who believe in this. Michigan, I don't have to tell you, sits in the carotid artery of American politics. They're going to look at wins on the coast and say, well, that's the coasts. But you can't say that about Michigan. If we win statewide in Michigan, what we are doing is blowing open a pathway for everyone running for president to be able to run on this message and to win. All right? And so even if you're not from Michigan, I see some Michiganders out here, even if you're not from Michigan, this campaign matters for you. And so I hope that you will be generous with us. You'll support this campaign. You'll support what we're trying to do here. Michiganders need and deserve health care. Americans need and deserve health care. And that has to come because we build a movement to provide that for everybody. So with that, I'm going to leave it there. I'll ask if folks have some questions, and then we'll go from there. Emma, we good? No questions?
No, we want to make sure we eat while the food is warm. So
All right.
Abdul will be
You can take